Here are 6 things you should avoid with gastric sleeve surgery. I'm Dr. Álvarez with Endobariatric.com, and here are 6 things you should avoid after having a gastric sleeve surgery. So let's get into it. Number 1 is soda. But wait, Dr. A, I drink or I like diet sodas or sugar-free sodas. No. I don't care much about what type you like. You should avoid sodas of any kind. And yes, I'm concerned about the calories, but carbonation is not your friend. And you need to understand this, especially the first few months right after surgery. Anything that's carbonated, it could be carbonated water, it could be any type of soda, because diet soda, regular soda, any type of soda has carbonation, and that is what you should avoid, because the carbonation will affect the inner lining of your stomach and will irritate your new sleeve. The first few months after surgery, we want to cool down that sleeve. We want to bring that inflammation down, and drinking sodas won't go that way. It'll go the other way. So avoid sodas. Number 2 is sugary drinks. Actually, you should avoid any type of liquid that has calories. You should be drinking water or unsweet tea or anything like that, and don't be drinking your calories. You need to understand this, because anything with sugar will sabotage your sleeve. So remember, the sleeve works with solids, and it works with solids once you start eating down the road, not right away, because right away we push the fluids, because it's called clear liquids and then full liquids and so on and so forth. Yes, we do liquids, and we push some sugar the first 2 or 3 weeks, because at that point we don't want you to feel weak or feel lightheaded, and the sugar helps at that point. The energy level helps at that point. But once we start eating down the road, please learn to not drink your calories, all right? Do unsweet tea, just any type of, anything without calories. Remember that the sleeve works with solids once you start eating down the road. It does not work with fluids, with liquids. So anything with sugar in a liquid form will run through your sleeve, and guess what? You're sabotaging your sleeve. You'll be like, why am I stalling at this point? Why am I not getting to the point I'm at? I'm lost. And sometimes it's as easy as sugary drinks. Number 3 is gum. Yes, we've talked about this before. I actually did a video just talking specifically about gum, and it's not the gum content which I'm worried about. It's the chewing of gum will make you unconsciously swallow air. So gum is not a good idea the first few months after surgery, maybe 4 to 6 months. After that, you'll create that space, the inflammation will come down, and your sleeve will tolerate that air you're swallowing. So is it a complete no? It's actually a complete no the first 4 or 6 months right after surgery. So avoid gum. Because what happens if you do gum? Well, you're going to be swallowing that air. It's going to come down your esophagus into your new sleeve, your new tummy, and it'll get very uncomfortable. I like to put it this way. It's like a baby's stomach. Babies, when they've got air trapped, they cry, they're very uncomfortable, and the same sensation goes with your new sleeve. Until that inflammation comes down and you're able to tolerate the gas, the air that you're swallowing, nothing will happen. I'm trying to avoid you this uncomfortable sensation. Number 4 is straws. And yes, we've talked about this before, and it's very similar to the gum that we just talked about, because straws, what happens? I'm talking about regular straws. You can do like the little straws like that come at in the high seas drinks, and those little straws are not a problem, all right? So I'm talking about regular straws. When you're drinking from a straw, again, the first 4 to 6 months after your sleeve, you're creating this suction on the straw, and before the liquid, you're pulling a column of air into you, and you're swallowing that air before the liquid. That air, as the gum goes into your tummy, creates that uncomfortable sensation, and try to avoid it. Does it mean no straws forever? No, same goes for the gum. First 4 to 6 months, after that, your stomach will be able to tolerate it. Number 5 is eating and drinking at the same time. I know it creates a lot of issue on patients once they first hear this, but it's not as hard as it seems, all right? So the reason is once you start eating down the road, you're allowed to eat regular food, you'll be able to eat very small quantities, and they'll be in your new sleeve. They'll be just laying there while they're you're having digestion with your new stomach. And if you pour liquid, or you're actually drinking liquids right away, it'll run through your esophagus to your sleeve, and it'll try to go through these tiny little gaps between the solid chunks of food you just ate. It flips because by gravity, liquids go down, the fluid goes up, and it creates a very uncomfortable sensation to patients. Again, that's what I'm trying to avoid in your case. What happens if you do it? Nothing. Will you put yourself at risk? No. Will it blow up your sleeve? No. Nothing will happen. You'll just perceive a very uncomfortable sensation, which is what I'm trying to avoid. And for you to understand why is this scenario of we bariatric surgeons, well, trying to point you in the right direction and trying to avoid eating and drinking at the same time. Will it be like this forever? No. So put your mind at ease. Don't get overwhelmed with this, because this is very simple physics. And number 6, hot and spicy food. Yes, I'm sorry if you really like hot or spicy food. Count me in. The reason being is hot or spicy food will irritate the inner layer of your stomach. It will flare it up. Now, it doesn't mean that you can't ever have hot or spicy food. Do it with moderation every once in a while, and you should be just fine. But if you do it constantly, day after day, with a sleeve or without a sleeve, it will cause some gastritis, some inflammation of the inner layer of your stomach. All right, so there you have it. Those are 6 things that you should avoid with gastric sleeve surgery. And if you're interested of me doing a specific video on a certain topic, let me know in the comments down below. I really appreciate it. And leave me one of these, please. Helps me a lot here on the support of the channel. And don't forget to subscribe. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.